Hi, everyone. I'm Jerlise Diaz with the Record Journal. We're here with our new weekly segment, Ask the Expert, in partnership with Hartford Healthcare's MidState Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health. We'll talk about various aspects of the vaccine rollout and have a medical expert answer a weekly question. Today, I'm joined by Alexandra Edmonson, family nurse practitioner at Community Health Center. This week's question is, what are some of the side effects people might experience after getting vaccines and how long do they last?
Hi, everyone. I'm Alexandra. First of all, I think it's important to remember that side effects are possible when receiving any vaccine, and to keep in mind that side effects can be local, so meaning that you experience something where the injection site occurred, for example, arm soreness, swelling, redness, or they can be systemic, meaning they can affect your whole body. And those would be things like fever, chills, fatigue, muscle aches. And I think most of us have experienced some local side effects when we get a tetanus shot, for example, and having a sore arm. And many of us have experienced kind of those mild flu-like symptoms after receiving a flu vaccine. And sometimes people mistakenly think those are one getting the flu illness itself. But really, it's just your body's way of mounting an immune response and forming antibodies to keep us safe. And it's hard work fighting viruses like the COVID and bacteria. And it takes extra energy for our bodies to do that. So we can feel a little run down in the meantime. In data published by the CDC regarding the first month of COVID-19 vaccinations, so this was from December 14th to January 13th, 9 side effects were reported regarding people who had their first dose of the Pfizer vaccine or Moderna. Regarding local side effects on day 1 after receiving the first dose of the vaccine, injection site pain was very common. 73% of Pfizer vaccine recipients experienced injection site pain, and 78% of Moderna vaccine recipients experienced it, as well as injection site swelling, 4% of Pfizer vaccine recipients and 6% of Moderna vaccine recipients. In terms of the systemic side effects, on day 1 after receiving the first dose of the COVID vaccine, fatigue was the most common. 22% of Pfizer vaccine recipients had fatigue. 25% of people who had the Moderna vaccine had it. Headache was slightly less common, 18% for Pfizer, 20% for Moderna. Muscle aches, 15% of Pfizer vaccine recipients, 18% for Moderna. Chills, 6% for Pfizer, 8% for Moderna. Fever, 6% for Pfizer, 8% for Moderna. Joint pain, slightly less common, 5% for Pfizer, 7% for Moderna. And the last one was nausea, 4% for Pfizer, 6% for Moderna. And then in the same report, they also published the results of after the second vaccine, but only for Pfizer. We don't have that data for Moderna. And it's interesting that all of the 9 side effects, everything increases significantly after the second dose, which is something that we've seen in practice. A lot of people are feeling okay after the first dose, and then they really feel a lot more run down after the second dose. So in terms of the local side effects, the injection site pain after a second dose of Pfizer, 79%, injection site swelling, 9%. And in terms of the systemic side effects, fatigue jumped up to 54%, headache to 43%, muscle aches to 47%, chills to 31%, fever to 29%, joint pain to 24%, and nausea to 14%. So some of those side effects increased as much as over 5 times from the first dose to the second dose. So that's something to keep in mind. And even though we don't have any data on the Moderna the second dose, anecdotal evidence is very consistent with the Pfizer vaccine results. A lot of people, everyone's different, but a lot of people are experiencing those side effects for 1 to 2 days. So if it's something that you're worried about, and you don't want to have to call out of work, doing it on like a Friday or over the weekend can be a really good idea. And I'll just say personally, I received my second dose of Moderna at 5 o'clock one day, and then I was out in the snow and the cold at 8 a.m. the following morning giving other people their vaccines. I was fine. So it really depends. And then I'll just quickly mention concern about a severe reaction. So over that first month, again, of vaccine administration, per 1 million cases of vaccines administered, there were 4.7 cases of Pfizer vaccine recipients who experienced anaphylaxis, which is a very severe and potentially life-threatening reaction that can occur when you're exposed to an allergen. And as far as Moderna goes, 2.5 cases per 1 million dose of vaccine had anaphylaxis as well. So it's very, very uncommon, but that's an additional and concerning side effect.
Okay, thank you, Alexandra Edmonson, for joining us today, and thank you all for watching. Tune in next week for our next Ask the Expert. If you have a question and would like it answered, leave it in the comments and we'll add it to our list. Thank you again for our partners for making this possible: Hartford Healthcare's MidState Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health.